A bill for an act to repeal the National Health Insurance Scheme Act and establish in its place a National Health Insurance Commission has since late last year passed second reading on the floor of the Nigerian Senate. At a time that the nation has been on a 24-hour alert because of the coronavirus outbreak, there's a growing call for a facilitation of this piece of legislation as a way of ensuring that more and more Nigerians would have a functional health insurance policy to fall back on. The objective of the bill is to ensure a more effective implementation of a national health insurance policy that would enhance access to healthcare services to all Nigerians, making health insurance compulsory, as well as promote and effectively regulate health insurance schemes in the country. We're now going to spend some time discussing this with Adesimbo Ukiri, Pioneer Managing Director and Chief Executive Officer of Avon Healthcare Limited, a leading Nigerian health management organization. She'll also be telling us more about the expected role of health management organizations in the health sector, particularly at a time like this. Welcome to the program. Good morning. Thank you for joining us.
Thank you. It's a pleasure to be here.
Yes, well, good to have you here, Dr. Ukiri. But before we talk about the bill, legislation, and all of that, I think we would like to have your thoughts on how Nigeria is managing the coronavirus challenge. What's your assessment of what has been done so far? What do you think, we still need to do that we're not doing? And what's your general impression about how coronavirus has become a pandemic?
Thank you very much. I'm actually not a doctor.
You're not a doctor?
Yeah, I'm extremely flattered that many people seem to think that I am, but I'm not a doctor,
okay.
Even though I am the CEO of Avon HMO. I think I have to commend us Nigerians and the Federal Ministry of Health and Lagos State in particular, the kind of machinery that has been put in place and the level of response so far. We have an index case that was very, very quickly recognized, tested positive, and was quarantined immediately. And the only other case we've had has been someone who had contact with the index case. And I do believe from what we're reading in the newspapers and the updates we're having that, over about maybe 20, 21 people have been quarantined as well. All the people that had contact with that index case has been quarantined. I mean, compare this with what you have in other leading economies of the world and much more developed country, and you would, tend to want to agree with me that we do deserve a pat on the back. It's interesting that, other countries are now talking about some kind of economic rescue for how, businesses would be affected, individual families would be affected through loss of earnings, staying at home and all of that. But, because we have just these two incidents, I think that there's not yet a need for our government to start thinking of some economic relief because of the coronavirus. And if we continue with what we're doing, I seriously do believe that we will not see the levels of infection and adverse effect on the economy that other countries in the developed world has.
From your lips to God's ears.
Amen.
Now, as a preamble to the discussion on this piece of legislation, let's talk about the role of HMOs generally, and especially in a time like this of, well, in spite of so far so good, positive news, it's a time of heightened concern.
Yeah, the first and the most important thing I think we do is educate the public. We do cover maybe about 6%, 5% of Nigerians under some health insurance scheme or the other. You'll agree with me that is really, really, really a small percentage of Nigerians. So what we want to do and what we are currently doing is making sure that we are able to reach far more than the people that we actually cover for the health insurance plan. Even if you're not covered by the plan, at least we can educate you. We can arm you with information. We can guide you. We can tell you what to do, who to contact, how to prevent it spreading, and how to also ensure that you keep yourself safe. And this is the part in which we have expended most efforts, through text messages, through emails, through blasts on our social media handles. In addition to that as well, because we work with a network of hospitals, it's also to keep reconfirming to those hospitals what steps they need to take in case they come across someone who looks like they have, symptoms of the coronavirus, when they enter their facility. In addition to that, also our corporate clients, we send them communication on what to do. We've advised all of them now that, at the places of work, as people come in, they should have hand sanitizers at their entry. They should also step up the hygiene measures in their office premises, wipe door handles with bleach, a whole list of things. I hope they don't get too tired of us reminding them of all these measures, almost on a weekly basis. But that's something that, we take really, really seriously, because prevention is better than cure.
Well, last year, let's talk about the National Health Insurance Commission Act.
Bill.
Bill.
Yeah.
It's still a bill, which is meant to repeal the National Health Insurance Act. And the whole objective is to increase access to affordable health care, ensure universal coverage. Now, the challenge with health insurance in Nigeria, is it really about legislation? Considering the fact that even when the National Health Insurance Scheme was introduced, yes, we had the same kind of optimism that it would perform the magic, but nothing really happened. So what do you think repealing the act and coming with another act would do?
Yeah, I think it's really interesting you mentioned that, because that's the real crux of the matter. The earlier National Health Insurance Scheme Act did not make it compulsory. It wasn't mandatory for all Nigerians to be on some form of health insurance scheme or the other. And that's where its greatest flaw was. Because in other countries where you have universal health coverage being achieved or being near achieved, they make it mandatory. The pool must be so wide that it covers virtually everybody in the country. And that's what's lacking now. That's the first and most important thing that the National Health Insurance Commission Bill seeks to address. Because in this bill now, it is compulsory for all employers of up to 5 people to ensure that they are registered under the scheme. This, you can agree with me, goes to the very root of what the problem of the original act was. In addition to that as well, an important thing it does is that it prescribes a basic minimum package, which will be part-funded from that 1% under the National Health Provision Fund. So what it means right now is that there's also funds being provided for people who cannot afford it, for the most vulnerable in the society. And we really didn't have that before. It's interesting. Many states in Nigeria have set up state national health insurance schemes. The old act also didn't recognize this or give room for it. In fact, it used to be a point of contention between the federal NHIS and the states who felt they should be able to run their own state schemes independently. So this new commission recognizes the right of states to do that, and it empowers them so to do. But what it does, which is very reassuring for people like us in the industry, is that it seeks to bring the entire pool together. So yes, state health insurance schemes can have their state-run schemes. And, many states are now saying they are also going to make it compulsory for all residents in the states to fall under a health insurance scheme. And this new bill proposes that, yes, that is fine, but we also want to be able to give you part of this National Health Provision Fund. And for us to do that, please share your data with us. Let us see who you are registering, how you are registering them, and we will give you this amount of money to support whatever it is you're spending in your state. So hopefully what it means is that, at the state level, at the federal level, we have agencies working together to make sure all Nigerians will have access to health.
Great. What about the financial implications of the new act, making it mandatory? What happened with the NHIS, the scheme that was not mandatory, was that only around 2% of the population bothered to register. For some people, it's the money, it's the financial constraints. Now that it's been made mandatory, we already have taxes to pay, we have this, that, or the other. What is the incentive there for people to actually play their role and pay?
Yeah, again, the first act, it wasn't mandatory, and the coverage we have actually achieved so far is mainly federal civil servants and large, medium-sized corporates. So you have SMEs, you have individuals and their families not really subscribing to the health insurance plan in any significant number. Now, when this new bill is passed and then is signed into law and it's compulsory for everybody to pay, the National Health Insurance Provision Fund, don't forget, is there to pay for those who are unable to afford it. And, right now, if we look at it as well, even those who now can afford it are simply not subscribing to it. Companies who are making quite, a lot of profit are not contributing towards the health of their workers. Sometimes you have people who fall ill in their place of work or who, for some other reason, contact something. And when they appeal to maybe the HR department or something for help, the more humane companies then find themselves paying out of pocket, sometimes quite large sums of money to look after the health of their staff. Meanwhile, if they could proactively subscribe to a health insurance scheme, this wouldn't be the case. It would be something that is planned for, that is budgeted, and no matter what happens to the health of the staff, they pay the same amount. So it's either way you look at it, it's a vast improvement on where we're coming from.
You'll recall that the NHIS was, since it was inaugurated, the headquarters of corruption and, poor governance. One head of the NHIS program after the other was involved in one controversy after the other. Now, I understand the objectives of this new legislation, but what is the guarantee that the health insurance scheme would be better managed? Because in my view, at the national level, the biggest problem was one of leadership and of good governance, good corporate governance. Even the HMOs themselves have their own challenges and their own problems. So do you think that this new bill will just eliminate all the problems?
I think the new bill is a good way to start. Part of the problem in previous regimes, as you rightly said, was this issue of corruption, because there's quite a large amount of money that the NHIS, sits on top of. But what we've always clamored for was for there to be a separation. Previously we had the NHIS being a regulator, being an operator, and being the holder of funds. No other regulator really does that. And that, of course, made them quite ineffective in the way they were able to discharge their duties. Because, just the sheer amount of the funds that is sat on was incredible. And in addition to that, being an operator also meant that from time to time they felt, they took actions that were not necessarily supportive of the entire industry to move the industry forward. At the public hearing of this bill last week, we did make this point in the submissions that we made to the Senate. And we believe also that, a good choice has been made in the current ES, in the current executive
Well, if you
secretary.
may just hold your thoughts on this, we'll take a short break now. When we return, the conversation with Adesimbo Ukiri will continue. We'll take a short break. Welcome back to the Morning Show here on NHIS News. Still with us in our Lagos studio is Adesimbo Ukiri, Pioneer Managing Director and Chief Executive Officer of Avon Healthcare Limited, who has been talking about the health insurance regime in Nigeria and the proposed National Health Insurance Commission Bill. Now, we were talking about corruption, governance issues in the health insurance space in Nigeria. If you could just conclude your thoughts on that.
Yeah, it's what I was saying was that what we are hoping that this new bill, when it comes into law, will achieve is to make the National Health Insurance Regulator a pure regulator. When we compare, the scheme and the regulator to its peers, in, for instance, the insurance sector, the core insurance sector, NICOM, for instance, doesn't hold any funds. NICOM doesn't operate any insurance company. All it does is to regulate all the operators, giving guidelines for how they operate in the market and helping to push them towards a path of growth and a path of strength for the benefit of the people who use them. The same thing with PENCOM. The regulator doesn't hold any funds, doesn't sit on any funds or control any funds, and it definitely doesn't operate any pension fund. What it does, it makes sure that it creates an enabling environment where all the operators within the sector operate, ensures everybody's playing by the rules, penalizes who doesn't. So they effectively regulate. A lot of the challenges that the NHIS has had in the past was that it was playing these three roles, and that can be quite confusing, bring about lots of conflict of interests, situations. So I think structurally we all have to push for the new act when it is enacted to make this demarcation for the regulator. I believe the man we have at the helm of affairs right now, our new ES, has the same line of thought. He really does want a sector that is much stronger than what he met. He engages with us operators a lot more, and we've had discussions. He was also at the public hearing for this bill a couple of weeks ago, and we could see that most of our thoughts were in alignment.
Well, speaking of the importance of an effective regulator, there were criticisms under the NHIS that HMOs were under-regulated and under-supervised, and there was collusion with the NHIS turning a blind eye to HMOs rendering poor service. What's your take on that?
I think based on what I said earlier, I wouldn't say the regulatory duties or functions of the NHIS prior to now had been at any level where we all hoped it would be. It really hasn't, and that's a failure that I'm sure even the most ardent supporters of NHIS would acknowledge. That notwithstanding, though, you know, in every industry you have players who play by the rule, players who are doing their best to move the industry forward, and then you have a couple who don't quite live up to expectation. What we expect to have is a regulator who is able to enforce whatever, you know, the rules and guidelines are in place for operation within the industry, and basically just clean the place up and make sure that penalties are applied to those who don't play by the rules. So you are right. I'm not going to say every HMO is perfect or every HMO operates in exactly the way it's meant to. But that's why we look up to a regulator. We want a regulator that will be able to, without fear or favor, ensure that the sector delivers on its promise to Nigerians.
Well, I think, you know, for the purposes of contextualizing all of this, you will recall that in 2019, early 2019, this same National Health Insurance Commission bill was considered by the 8th National Assembly. I think at the time it was Senator Tejushu who was chairman of the Senate Committee on Health, and it went past third reading, and it was passed eventually by the Senate. So what exactly happened? Is it that the president did not sign it, and that's why the 9th Assembly is taking it up again? And what is the guarantee that this time it will eventually become law?
Yeah, so I'm aware of that as well, and we were all very, very disappointed that it didn't get signed by the president. I don't want to in any way imply that I know the inner workings of our federal, you know, government and how the, you know, the negotiations, the administration of, you know, passing the bill from the Senate to the presidency works. But I seem to recall it was also passed a bit very, very late, and my understanding or my suspicions is that there were certain gaps in that earlier one that this one now seeks to address. And maybe certain stakeholders also felt they weren't carried along enough. You know, with this particular bill, honestly, when I was in Abuja for the reading, all the stakeholders you could imagine were present. The union was present, the Guild of Medical Directors were present, NMA was present, ourselves, HMOs were present, and everybody had a say. And all the submissions we made were actually weighed. I mean, I have to commend Senator Oloriegbe, who chairs the Senate Committee on Health currently. I mean, he did a fantastic job of acknowledging each stakeholder's contribution, of weaving it all together into the context of what we're trying to achieve by a nation, and then trying to ensure that, you know, nobody was shut down and everything was acknowledged. The ones he didn't agree with, you couldn't fault his logic at the end of the day. And because we are all working towards the same goal, which is universal health coverage in this country, every Nigerian, no matter your status in life, your political leanings, your income level, should be able to have access to a basic minimum healthcare package. When we think of that larger goal, everybody is able to, you know, give some compromises and make sure that we're all moving in the right direction. So I'm very hopeful about this particular bill being passed into law. Nobody can say they were left out.
Great. Speaking of that larger goal, Nigeria is one of the African countries that has subscribed to universal healthcare by 2030. How far along are we to achieving that goal? And what needs to be done at this point to make sure we do, or attempt to?
I think, honestly, this bill is a step in the right direction because no country has ever achieved universal health coverage without making subscription to a health insurance scheme compulsory. So the fact that we're doing this is great. The fact that we have state governments also on their own passing out similar laws in their states, and that they are now also putting their money where their mouth is and setting up their own state health insurance schemes is great. And that will filter down to the local government. What we need to look at very, very closely, though, is the provision side. it's good that we're putting together all these structures, we're putting together all these monies and pooling it together in order to give people financial access. But have we looked at our infrastructure on the hospital, on the delivery side, hospitals, diagnostics, even pharmaceuticals? Are we able to meet the demand that we are creating? So the supply side is what gives me the most fear. As a country, are we doing enough now to build that side? Are we making sure that every Nigerian, no matter where they live, they have access to a reasonably good healthcare facility within a few, miles from their homes? In addition to that as well, what are we doing to also combat, the challenges we have around pharmaceuticals and drugs? How are we supporting local manufacturers? How are we ensuring that, the incidence of fake and ineffectual drugs in our market are being dealt with? Because all of this come into play.
Yeah, I agree with you. The point you have made about the supply side, I mean, a major issue there is also the doctor-to-patient ratio that we have in Nigeria. But on the demand side, there's also a problem. The biggest problem in the health sector in Nigeria is that most people seeking healthcare services depend on out-of-pocket expenditure. They constitute the biggest percentage of people seeking healthcare. So how will this creation of another bureaucracy, how will it help? How will it address the interests of, say, market women, artisans, people in the, informal sector? You've talked about the provision fund, but we know that this is Nigeria. Oftentimes, the informal sector will just be ignored. We don't factor it into the calculations. Is there any hope for that out-of-pocket expenditure-dependent patients seeking healthcare?
That is exactly what we're hoping this bill will help to address, and the participation of state governments. Because if we were talking about the formal sector, already that's more or less covered. Federal civil servants are covered. It's very easy right now. All the states that have promulgated their own health insurance, state health insurance schemes, have covered their civil servants. So the formal sector, and by and large, most large companies and medium-sized companies have fallen under some private health insurance scheme or the other. So it's really the informal sector that this bill seeks to address, in recognition of the fact that most Nigerians fall into this category of informal sector. That's why now state health insurance schemes are the ones that are spearheading the drive to fold in the market women, to fold in the vulcanizers. And they're doing this through their associations. Some of us health management organizations are working with state health governments. So we're following them, with, working with them to do outreaches in these locations. And, at the end of the day, I believe that state governments are peculiarly positioned to make it happen, to enforce it, because they know how to collect their local government levies and the stuff. They know how, through the school system, to ensure that the children that come into the public schools, their parents have registered for the health insurance scheme. And the support they are also receiving from the NHIS through this basic health provision fund, add that to the support that also international NGOs are giving them for, areas within their states that are below the poverty line. So there's a lot of support that comes in once we have the regulatory framework and the infrastructure to show that we have the capacity to attend to these people.
What kind of orientation programs and sensitization advocacy goes on? Because a lot of people don't understand the benefits of health insurance.
Yeah, so this is done in two ways. For the people who we believe, the majority of young Nigerians, who we believe are internet savvy, are on social media in one way or the other, there's a lot that goes on our Twitter handles, like I said, on all the other social media handles, Facebook, etc., etc. The young people, we recognize that, Nigerians right now in middle age and above, they're pretty set in the way they think about health insurance. Growing up and in their own early working years, it never really sank in that health insurance was something you set money aside for, the way you would for rent of your children's school fees, etc. It's more like, God forbid I'm ill, my pastor will take care of me. They walk into a pharmacy. Some of them, they have the woman that sells herbs and concoctions that they know if I just take one agbo, I will be okay. But we believe that the younger crop of Nigerians we're having, this is a good opportunity to change their mindset right from when they're young. So as they move older and become more established in their income-generating capabilities, they are already used to the idea of health insurance and setting money aside. So we don't treat that, audience lightly at all. But for the others who are like in the markets, etc., that has to be face-to-face. So we do skits on radio, we do radio programs, and sometimes we go into these places and do small talk, one-on-one events, market storming, with people who go in there and educate them on what health insurance is and why they should participate in it.
Well, thank you very much. Thank you for joining us on the morning show today. Thank you very much.
It's been my pleasure. Thank you for having me.